Question 1. Define PPH. Enlist the causes of PPH and explain the nursing management of PPH. हाश समझने के लिए PPH क्या होता है? PPH को postpartum hemorrhage. MATLAB delivery के बाद excessive bleeding होना. Normally delivery के बाद blood loss होता है, but agar vaginal delivery में 500 ml blood loss, cesarean delivery में 1000 ml blood loss हो जाए, उसको PPH कहते हैं. ये maternal death का एक major cause है. PPH किन होता है? Doctors usually 4T rule use करते हैं. Tone, uterus properly contract nahi karta, uterine atony. Trauma, birth canal injury, tear, episiotomy. Tissue, placenta ka kuch part uterus में रह जाना, thrombin, blood clotting disorder. Ye PPH के main causes हैं. PPH में nurse का aim होता है bleeding control karna, mother ko shock se bachana, doctor ko assist karna. Important steps: uterine massage, oxytocin injection, vital signs monitoring, IV fluids, blood transfusion if needed. Final exam ready answer: write an exam. Postpartum hemorrhage, PPH. Introduction. Postpartum hemorrhage is one of the most serious complications of childbirth and a leading cause of maternal mortality worldwide. It occurs due to excessive bleeding after delivery and requires immediate medical and nursing management. Definition. Postpartum hemorrhage is defined as excessive bleeding of more than 500 milliliters after vaginal delivery or more than 1,000 milliliters after cesarean delivery within 24 hours after childbirth. Causes of PPH. The causes of PPH are commonly explained by the 4Ts. 1. Tone, uterine atony, failure of uterus to contract after delivery, most common cause of PPH. 2. Trauma, lacerations or tears of cervix, vagina or perineum, episiotomy, uterine rupture. 3. Tissue, retained placental fragments, placenta accreta. 4. Thrombin, blood clotting disorders, disseminated intravascular coagulation. Nursing management of PPH. Assess maternal vital signs regularly. Monitor amount of vaginal bleeding. Perform uterine massage to promote uterine contraction. Administer uterotonic drugs such as oxytocin as prescribed. Maintain intravenous fluid therapy. Prepare for blood transfusion if required. Monitor urine output and intake. Provide oxygen therapy if needed. Maintain a septic technique during procedures. Provide emotional support to the mother. Question 2. Define pregnancy and explain physiological changes during pregnancy. समझने के लिए. Pregnancy क्या होता है? Pregnancy मतलब जब fertilized ovum uterus में implant हो जाता है और fetus develop होना start करता है. ये period usually about 40 weeks, 9 months, का होता है, from conception to delivery. Pregnancy के दौरान mother के body में बहुत सारे physiological changes होते हैं, ताकि fetus को nutrition मिले, uterus fetus को support करे, delivery के लिए body prepare हो. Physiological changes क्या होते हैं? Pregnancy में almost सब body systems change होते हैं. Main changes होते हैं: reproductive system, uterus enlarge होता है, cervix soft हो जाता है, vaginal blood supply increase होता है. Cardiovascular system, blood volume increase होता है, heart rate थोड़े increase होता है, cardiac output increase होता है. Respiratory system, oxygen demand increase होता है, breathing थोड़ा deep हो जाता है. Urinary system, kidney blood flow increase होता है, frequent urination होता है. Digestive system, nausea and vomiting, heartburn, constipation. Endocrine system, hormones increase होता है, estrogen, progesterone, HCG. Skin changes, linea nigra, cloasma, mask of pregnancy, stretch marks. ये सब normal physiological changes हैं pregnancy में. Define pregnancy and explain physiological changes during pregnancy. Introduction. Pregnancy is a normal physiological condition in which a woman carries a developing fetus in her uterus. It begins with fertilization of the ovum by sperm and implantation in the uterus, and continues until the birth of the baby. During pregnancy, several physiological changes occur in the maternal body to support the growth and development of the fetus and to prepare the mother for childbirth. Definition. Pregnancy is defined as the period from conception to birth during which a fertilized ovum develops into a fetus in the uterus, usually lasting about 40 weeks. Physiological changes during pregnancy. Physiological changes occur in different body systems. Reproductive system. Uterus enlarges to accommodate the growing fetus. Cervix becomes soft and vascular. Increased vaginal secretions occur. Cardiovascular system. Blood volume increases to supply oxygen and nutrients to the fetus. Heart rate increases slightly. Cardiac output increases during pregnancy. Respiratory system. Oxygen consumption increases. Respiratory rate may increase slightly to meet fetal oxygen demand. Urinary system. Renal blood flow increases. Frequent urination occurs due to pressure of the uterus on the bladder. Gastrointestinal system. Nausea and vomiting, morning sickness may occur. Heartburn and constipation are common. Endocrine system. Increased production of estrogen, progesterone, and HCG hormones to maintain pregnancy. Skin changes, linea nigra, dark line on abdomen, cloasma, mask of pregnancy, striae gravidarum, stretch marks. Question 3. Write stages of labor and describe nursing management of second stage and third stage of labor. लेबर क्या होता है? लेबर एक फिजियोलॉजिकल प्रोसेस है जिसमें यूटरस की रिदमिक कंट्रैक्शंस की हेल्प से फीटस, प्लेसेंटा और मेम्ब्रेन्स यूटरस से बाहर एक्सपेल होते हैं. सिंपल वर्ड्स में बेबी का यूटरस से बर्थ कैनाल की थ्रू बाहर आना लेबर. लेबर की स्टेजेस. लेबर को 4 स्टेजेस में डिवाइड किया जाता है. फर्स्ट स्टेज, cervical dilatation stage. ये stage true labor contraction से start होता है और cervix की complete dilatation 10 cm पर end होता है. इस stage में cervix thin, effacement और open dilation होता है. इसकी 3 phases होते हैं. Latent phase 0 to 3 cm, active phase 4 to 7 cm, transition phase 8 to 10 cm. Second stage, expulsion stage. ये stage complete cervical dilatation से start होता है और baby के birth पर end होता है. Is stage में uterine contractions plus mother की pushing efforts see baby deliver होता है. Third stage, placental stage. ये stage baby के delivery के बाद start होता है और placenta की expulsion पर end होता है. Usually 5 to 15 minutes में placenta deliver हो जाता है. Fourth stage, recovery stage. ये delivery के बाद के first 1 to 2 hours होते हैं, जिसमें mother को closely observe किया जाता है. Nursing management. Is question me second or third stage ka management detail me likhna hota hai. Final exam ready answer. Stages of labor and nursing management of second and third stage of labor. Introduction. Labor is a physiological process that occurs at the end of pregnancy, during which the uterus contracts rhythmically to expel the fetus, placenta, and membranes through the birth canal. Definition of labor. Labor is defined as the process of expulsion of the fetus, placenta, and membranes from the uterus through the birth canal by effective uterine contractions after the period of viability. Stages of labor. Labor is divided into 4 stages. First stage, cervical dilatation stage. This stage begins with the onset of true labor contractions and ends with complete dilatation of the cervix, 10 centimeters. Phases, latent phase, cervical dilatation 0 to 3 centimeters, active phase, cervical dilatation 4 to 7 centimeters, transition phase, cervical dilatation 8 to 10 centimeters. Second stage, expulsion stage. This stage begins with complete cervical dilatation and ends with the birth of the baby. Nursing management of second stage, prepare sterile delivery instruments, maintain aseptic technique, monitor fetal heart rate regularly, encourage the mother to bear down during contractions, provide emotional support and reassurance. Assist the mother in proper position for delivery. Support the perineum to prevent tearing. Assist in delivery of the baby. Clear newborn airway by suctioning mouth and nose. Dry the baby and maintain warmth. Assess newborn using APGAR score. Hack third stage, placental stage. This stage begins after delivery of the baby and ends with expulsion of placenta and membranes. Nursing management of third stage. Observe signs of placental separation. Administer uterotonic drugs such as oxytocin. Assist in controlled cord traction. Inspect placenta and membranes for completeness. Assess uterine contraction and fundal firmness. Monitor maternal vital signs. Observe for postpartum hemorrhage. Maintain perineal hygiene. Record time of placental delivery and blood loss. Fourth stage, recovery stage. This stage is the first 1 to 2 hours after delivery of placenta, during which the mother is closely monitored. Question 4. What is PIH? Explain the signs and symptoms of preeclampsia. Discuss the nursing management of preeclampsia. समझने के लिए PIH क्या होता है? PIH, pregnancy-induced hypertension. MATLAB pregnancy के दौरान BP का बाद जना. अगर 20 वीक्स के बाद BP 140 90 मिलीग्राम या ज्यादा हो जाए तो उसको PIH कहते हैं। प्रीएक्लैम्पशिया क्या क्या है? Preeclampsia, PIH का severe form है। इसमें mainly three important problems होती हैं. 1. High blood pressure, hypertension. 2. Protein in urine, proteinuria. Swelling of body edema. अगर treatment न मिले तो convulsions हो सकते हैं, उसको eclampsia कहते हैं। Symptoms क्या होते हैं? Pregnancy में placenta की blood supply में problem होने से blood pressure increase हो जाता है। Kidney effect होती है। Protein urine में आता है, body में fluid retain hota hai, swelling. So have important signs and symptoms: high blood pressure, protein in urine, swelling of face, hands, feet, severe headache, blurred vision, epigastric pain, nausea and vomiting. Nursing management. Nurse ka aim hota hai. BP control karna, mother or fetus co-monitor karna, seizures prevent karna. Important care: bed rest, BP monitoring, urine protein check, magnesium sulfate, antihypertensive drugs. Final exam ready answer: pregnancy-induced hypertension, PIH. Introduction. Pregnancy-induced hypertension is a common complication during pregnancy. It usually develops after 20 weeks of gestation and may affect both the mother and fetus if not properly managed. Definition of PIH, pregnancy-induced hypertension, is defined as an increase in blood pressure of 140/90 mmHg or more after 20 weeks of pregnancy in a previously normotensive woman. Preeclampsia. Preeclampsia is a pregnancy-specific hypertensive disorder characterized by high blood pressure, proteinuria, and edema. Signs and symptoms of preeclampsia. Major signs: hypertension, 140/90 mmHg, proteinuria, protein in urine, edema of face, hands, and feet. Other symptoms: severe headache, blurred vision, epigastric pain, nausea and vomiting, rapid weight gain. Severe symptoms: reduced urine output, hyperreflexia, convulsions, eclampsia. NAC nursing management of preeclampsia. Monitor maternal blood pressure regularly, check urine for protein, maintain bed rest in left lateral position, monitor fetal heart rate and fetal movements. Administer antihypertensive drugs as prescribed. Administer magnesium sulfate to prevent convulsions. Monitor intake and output of fluids. Observe for signs of complications. Provide emotional support and health education to the mother. Question 5. What is pregnancy? Write the importance of antenatal care during pregnancy and discuss minor disorders during pregnancy. समझने के लिए? Pregnancy क्या है? Pregnancy वो condition है जिसमें fertilized ovum uterus में develop होता है और fetus grow करता है until delivery. Normal pregnancy about 40 weeks, 9 months, चलती है. Antenatal ANC क्या होता है? Antenatal care mat lab pregnancy की दौरान mother और fetus की regular health checkup और care. इसका purpose होता है mother और baby दोनों को healthy रखना, complications को early detect करना, safe delivery prepare करना. Antenatal care important क्यों है? Mother की health monitoring, fetal growth check करना, complications detect करना, PIH, anemia, etc. Nutrition advice, vaccination. Health education. Tasha minor disorders during pregnancy. Pregnancy में कुछ common minor problems होती हैं जो usually dangerous नहीं होती. Examples: nausea and vomiting, heartburn, constipation, backache, leg cramps, frequent urination, varicose veins. Final exam ready answer: pregnancy, importance of antenatal care and minor disorders during pregnancy. Introduction. Pregnancy is a natural physiological condition in which a woman carries a developing fetus in her uterus. It begins with fertilization and implantation of the ovum and continues until the birth of the baby. Proper antenatal care during pregnancy is essential for maintaining the health of both the mother and fetus. Definition of pregnancy. Pregnancy is defined as the period from conception to birth during which a fertilized ovum develops into a fetus in the uterus, usually lasting about 40 weeks. Importance of antenatal care: helps in early detection of pregnancy complications, monitors growth and development of the fetus, maintains maternal health during pregnancy, provides nutritional advice and supplementation, prevents diseases through immunization such as tetanus toxoid, educates the mother about personal hygiene and diet, prepares the mother for safe delivery and parenthood. Minor disorders during pregnancy. Minor disorders are common problems that occur during pregnancy but usually do not cause serious complications. Common minor disorders: nausea and vomiting, morning sickness, heartburn and indigestion, constipation, backache, leg cramps, frequent urination, varicose veins. These conditions can usually be managed with proper diet, rest, and simple medical care. Question 6. Explain the levels of neonatal care. समझने के लिए. Neonatal period MATLAB, birth के बाद के first 28 days. Is time baby बहुत sensitive or vulnerable हो रहा है? Different levels of neonatal care बनाए गए हैं ताकि baby को condition के according care मिल सके. Neonatal care को 3 levels में divide किया जाता है. Level 1. Basic neonatal care. यह normal healthy newborns के लिए होता है. इसमें basic care दी जाती है. Temperature maintain करना, breastfeeding support, basic newborn examination, routine care. Usually a primary health center या normal maternity ward में मिलता है. Level 2. Special care nursery SCNU. ये उन babies के लिए होता है जो slightly sick या premature होते हैं. Example: low birth weight babies, mild respiratory problems, infection observation, is level par oxygen therapy or monitoring milti hai. Level 3, neonatal intensive care unit CU. Ye very sick newborns ke liye hota hai. Example: very premature babies, severe respiratory distress, birth asphyxia, serious infections. Isme advanced life support available hota hai. Ventilator, intensive monitoring, specialist doctors. Levels of neonatal introduction. The neonatal period refers to the first 28 days of life, which is a critical period for the survival and health of the newborn. Depending on the condition of the baby, different levels of neonatal care are provided. Levels of neonatal care. Neonatal care is generally divided into 3 levels. Level 1, basic neonatal care. This level provides basic care for healthy newborn babies. Services include routine newborn examination, maintaining body temperature, breastfeeding support, basic resuscitation if needed. Level 2, Special Care Neonatal Unit, SCNU. This level provides care for moderately ill newborns or premature babies. Services include care of low birth weight babies, oxygen therapy, monitoring of vital signs, treatment of mild infections. NASH Level 3, Neonatal Intensive Care Unit, NICU. This level provides advanced care for critically ill newborns. Services include mechanical ventilation, intensive monitoring, treatment of severe respiratory distress and infections, care of very premature infants. Question 7. Question 7. Describe the family planning program. समझने के लिए. Family planning क्या होता है? Family planning का मतलब है couple अपने बच्चों की number or spacing decide करे according to their health, economic condition, or family needs. Simple words में pregnancy को plan करना और unwanted pregnancy को prevent करना. Family Planning India में government ने family planning program start किया था, population control और maternal child health improve करने के लिए. Family planning program की main objectives: population growth control करना, mother or child health improve करना, unwanted pregnancy prevent करना, children की बीच proper spacing maintain करना. Family planning methods. Government couples को different contraceptive methods provide करती है. Temporary methods: condom, oral contraceptive pills, copper T IUCD, injectable contraceptives. Permanent methods: tubectomy, female sterilization, vasectomy, male sterilization. Importance of family planning: healthy mother, healthy child, economic stability of family, improved quality of life. Final exam-ready answer: family planning program. Introduction. Family planning is an important public health program aimed at controlling population growth and improving maternal and child health. It helps couples to decide the number of children and spacing between births. Definition. Family planning is defined as the practice of planning and spacing pregnancies through the use of contraceptive methods to improve the health and well-being of the family. Objectives of family planning program: to control population growth, to promote maternal and child health, to prevent unwanted pregnancies, to maintain proper spacing between children, to improve the quality of life of the family. Methods of family planning. Family planning methods are classified into temporary and permanent methods. Temporary methods: condom, oral contraceptive pills, intrauterine devices, copper T, injectable contraceptives. Permanent methods: Tubectomy, female sterilization. Vasectomy, male sterilization. Importance of family planning. Helps in maintaining small family size. Improves health of mother and child. Reduces maternal and infant mortality. Improves economic condition of the family.